The typical patient for hip arthritis comes in, they've lost mobility, they have pain in the joint, usually in the front, the groin, the side of the hip, and they've failed conservative measures such as anti-inflammatories like Advil, Aleve, possibly intra-articular cortisone injections into the joint. And when that happens, I recommend a hip replacement. Usually we're scheduled out about 6 weeks from the day someone comes in and is a candidate for hip replacement. I tell them typically the surgery takes about an hour, sometimes less. It's not a very long surgery. Talk about the incision length, which is about 3 to 4 inches, and then the hospital stay typically around 2 days, and then how they go home with home health and then start outpatient physical therapy at the 2-week mark. They do that for 4 weeks, and at the 6-week mark, again, usually walking without a limp, and at the 12-week mark, I release them to full activity. Again, whether it's hiking, bowling, golfing, those kinds of things, they can usually do at 12 weeks. So once we enter the joint, there's a capsule that surrounds the joint. We enter into it, and we remove the ball in the neck. The ball is already diseased, the cartilage is worn away. Occasionally, the disease process has been going on so long, the ball is flattened. It's no longer spherical, it's oval, or even worse. And we remove that part of it. We have special instruments that clean up any remaining cartilage on the cup side, give us a smooth hemispherical surface, and then we press fit a cup with a porous titanium. Very rarely do I use screws because the materials nowadays have such good friction, solid fit. And then we put in, for most patients, a advanced space-age plastic into the titanium shell. And then we specially prepare the femur and put in a femoral stem. What's nice about hip replacement surgery, and it's been, again, around since about the 70s, some form of the 60s. Even before then, people were experimenting with different types of material. Some of them which didn't work very well at all, Teflon, even glass, believe it or not, was used as a type of material for hip replacement. The surgery is excellent, with 98-99% excellent results. We know that in terms of measuring the quality of life years before and after surgery, the surgery is comparable to a quadruple bypass in terms of improving quality of life. So a phenomenal surgery. I in particular use, again, very last technology for my hip replacements, and that's where the ball or the femoral head that we use in the hip is a hybrid ceramic metal. So the ceramic on the outer layer decreases wear. So potentially the hip replacement will last 25, possibly even 30 years. And the space-age plastic is a highly cross-linked polyethylene, again with very low wear. And so we have no reason to believe that these hips won't last an extremely long period of time. I do a lot of other surgeries around the hip, and I did a fellowship training in hip preservation. So I do hip arthroscopy, I do surgical hip dislocations for various conditions. So I work with patients for hip-related issues from their teens all the way up to their 90s. So I in particular, enjoy working around the hip. I think hip replacement is such a good surgery that if someone needed it at any age, I would be more than happy to do it because I believe in the results and I believe in the longevity.